Hello, friends and family. So today, what I want to talk to you about is how is it possible for procrastination to hurt you in the long run when it comes to your dental health? And so, yes, that's a subject that I got took the inspiration from a patient that I saw this week that is a long-time patient of ours, but this patient oftentimes only comes when things have gone south, when something is hurting atrociously. That's when the person ends up coming, and so I looked at the patient's chart, and it had been a long time. It had been more than 5 years was the last time that I saw this particular patient. And when I looked at everything that was diagnosed at that point, the tooth in question, the tooth that brought the patient in, was a tooth that was diagnosed at the last appointment 5 years ago. And that tooth simply needed a filling. But now the patient came in because the tooth is starting to cause unbearable pain. And so, yes, the person had to leave everything that they were doing and come and find themselves on the chair. And even though, it would have been possible to save the tooth with some treatment, because of the level of pain that the patient was experiencing, that particular patient decided to just go ahead and have the tooth removed. And it's a tooth that could definitely be saved, but sometimes, with the level of pain that somebody might feel, they may just want it to be just completely over like the pain, and because they're completely over it. And so, the person just decided to have the tooth removed. And, at that, we have to honor the patient's wishes or desires. But that was not, definitely the best course of action for the patient, who could have saved that one tooth. So, yeah, procrastination for that particular patient, it lasted 5 years prior to, this tooth, the progression of the cavity reaching the nerve, and now, keeping the person at night awake. Person is constantly in pain, and that becomes unbearable. And that is simply due to procrastination, because, as I said, looking at the patient's chart, that particular tooth could have been definitely saved a long time ago, treated a long time ago. And I believe that, say, for example, if it was a situation where, it was painful, but, a filling could have been done, more than likely the patient would have not have selected to have the tooth extracted. But now, when you procrastinate and you just never know how long it takes, he was actually one of the lucky ones for whom it lasted, 5 years prior to the cavity actually reaching, the nerve. With some people, it takes a long time. With some people, the cavity progresses really, really, really rapidly. And so we can never, predict how long it's going to take prior to getting to this type of situation. And even with that particular patient, he would have had the opportunity to even save the tooth. He just didn't choose to do so. But, that particular patient would have had the opportunity to save the tooth, but decided not to. Some people, they don't even have that opportunity, because at that point, perhaps the tooth would have, broken down so much that it would have reached maybe like the gum level, to a point that it reached maybe the root, and then the tooth becomes unrestorable, or the tooth may crack. There's just so many different things. And even not just it just simply staying at having affected the tooth, the pain, or, the infection, the tooth can reach the gum, can reach the end of the root, can start, causing infection. And we see some people, coming with maybe like a swollen cheek, or, just in, a lot of pain and swelling because of infection. And as I usually say, that infection can go. It doesn't just stay in the mouth, it travels to the rest of the body. And it can cause so many different problems, affecting or exacerbating other types of diseases, like a stroke, like endocarditis, like, affecting diabetes, like, so many things, creating heart attacks, many things that can be prevented by not procrastinating. So I'm just here. I wanted to have a heart to heart with you today because of this, what happened. And I get it, some people are scared. Some people have experienced anxiety in the past. Some people, have heard so many horror stories, but we don't know where, those stories even stem from, and some of them are true. So people may not have time, people may not have the funds, which is the reason why, when you go to a dentist that you trust and that you like and that you believe that you can do business with, you definitely want to take in the recommendation early. The earlier you do the treatment that is recommended, the less you're likely to spend, and so if money is a thing for you, you definitely want to take your course of action as early as possible, because you will definitely be saving money versus waiting, procrastinating, and then, because you don't have pain, you even forget about it, and all of a sudden here you are at night, and or even during the day, you're at work or you're at school, and things start just shifting and you start experiencing a lot of pain. So I wanted to just have a heart to heart with you today, because this is a case that just broke my heart this week. And I just wanted to encourage you not to procrastinate. This is for your own health. This is for your own benefit. This is for your own, financial sense. So yeah, that's what I wanted to talk to you about today. So if you're looking for a friendly doctor, a doctor that understands, a doctor that is going to connect with you, even on an emotional level, I am that doctor. I am she. I'm Dr. Valerie Mukanga, and we are at Healing Wings Dental in Arlington, Texas, which is in the great DFW area. And our address is 4101 West Green Oaks Boulevard, suite number 317, and our zip code is 76016. Our phone number, if you want to secure an appointment, is 972-213-0202. And you can also reach us on social media to get great information. But on our website, you can reach us at healingwingsdental.com to also request an appointment. I talked about social media. We are on Facebook, we are on Instagram, and also on YouTube, where we strive to providing you with information that will enlighten you as far as your dental health. So yes, I wish you a very, very, very good and blessed day, and keep it positive. Keep the high energy level going, and that's only going to bless you. And keep a smile on your face. All right, take care. Bye.